Welcome to the Maternity and Midwifery Forum. My name's Neil Stewart. I'm the editorial director. We're presenting a whole day of live sessions and some of the top 10 or 15 videos from the Maternity and Midwifery archive. This program is supported by Matflix, the video streaming service from midwifery maternity experts, especially designed for students and for people going through their revalidation. And at a time when everyone's locked down, excellent way of keeping up with what on earth has been going on. We've had sessions all day today hearing from leading bloggers, commentators like Roy Lilly. We've had Jess Phillips, the shadow spokeswoman for the Labour Party, talking about domestic violence and her experience of it. Mary Renfrew, Leslie Page, Sue Down, and we've had Anna Byron and the practicing midwife team let loose. We've heard from Fran McConville and from Neil Shah from Harvard, who his opening line that an American woman today is 50% more likely to die in childbirth than her mother is one of the original showstoppers when it comes from a senior statistician in Harvard. We've been looking at the way that services have been affected by the lockdown and by the hospital concentration preparing for the virus and the demands that we'd make on them. We've been joking at the expense of politicians that some of them probably needed to have it explained to them that while they could cancel other operations, cancelling childbirth was a bit more tricky. And a number of hospitals now look like a major COVID-19 division, all sealed and protected, and then a maternity wing with not very much in between. And some of the other departments have been reporting that they've had very thin attendances. So it's had a big impact on services, and we're now looking at how they can be rolled back out over what could be quite a period of time. I'm joined by Karen Jewell, who's the Nursing Officer for Maternity and Early Years at the Office of the Chief Nursing Officer in Wales, and from Cardiff, and Amy Hargreaves, Professional Officer, New South Wales Nurses and Midwives Association from Sydney in Australia. So we're taking a long view to compare notes. So Karen, can you give us some observations as to how the virus has impacted on maternity and midwifery services, and anything that you've observed and would want to highlight, good and bad, that's or challenging, as we're required to say, that's happened over the past 6 weeks. So Karen, over to you.
Thank you. Well, firstly, as a midwife, I'd like to say Happy International Day of the Midwives to all the midwives in the UK and across the world. I think COVID has definitely brought us all together even more. And I would say in Wales, we've always been a very close family of midwives who've worked together to launch lots of things, including the future vision for maternity services, which was actually our work plan for this year, which has been stopped in some ways by COVID. But I think my major reflection about COVID is the fact that we have been able to put so many innovations in place. And in fact, I was talking to my fellow country leaders this morning around maternity services, and we've said that, you know, what we thought was going to take a year to put into practice actually has turned around in the space of a couple of weeks. And I think that's down to midwives working really hard together and thinking in different ways. And I know today you've probably heard lots of the different and innovative ways that we've already started working. Many of those being IT related, not just meetings like this, but actually we've been rolling out technology that's enabled consultations with women and their families in their homes when it's been clinically advised, to help support women who at this time are extremely anxious about accessing services, and we're really aware of that. And I think the stay home, stay safe message in some ways has backfired on us, because some people think hospitals are overwhelmed, we shouldn't be going in. So I know one of our communication mechanisms at the moment is very much to say to women, we are open for business, please do come in if you're worried about anything. I think in relation to COVID, like I say, especially with our future vision, it's been really interesting that the key themes that we had for our future vision were family-centred care, safe and effective care, continuity of care, skilled multi-professional teams and sustainable quality services. And what we've noticed is that everybody is coming together to plan services. And in Wales, we are a small country, but we actually have a weekly meeting where we discuss with health boards any COVID cases they may have, what their plans are like, and we're sharing best practice virtually every week, which then is impacting on service. Not only that, I think it's highlighted maternity to other areas. So as a midwife working in government, I found that I'm being pulled into lots of other areas, one of those key ones being essential services. So when we're looking at essential cancer services or other essential services, maternity are a key part of that. And that's enabled us to be ring fenced. So we've said that staffing in maternity is ring fenced. We don't want to see redeployment to other areas. But actually, it's about then again the communications that services are open and making sure that health boards are able to do that. So in relation to the political agenda, maternity is very much front and centre in this, in the fact that, as you say, we can't stop our service. It's not, an option. We have to be there every day to make sure that women are safe and also receive the quality experience that they want. This is their one birth option. They didn't know they were going to give birth during COVID. So actually, we have to make sure that they're protected both physically and emotionally. And emotionally is another area that we've really been working hard on, especially with our perinatal mental health teams, to make sure that women are supported at this time. And again, those services aren't depleted staff-wise. So I think that it's been an anxious time for both staff and for women, and we probably didn't realise what the impact of this was likely to be. I don't think anybody could have potentially prepared for it. I think we've prepared really well. We're now going into a different phase where we're starting to look at what services can we put back in place. So things like parenting, those sort of things. But again, we're looking at online services for those. But also thinking about the replication value of COVID and making sure that we don't make services unsafe by opening up things too quickly, and that we don't have another surge going down the line. So at the moment, we're doing something called pause and reflect. We're actually working with the senior clinicians to say, what have we done really well during this time, or what could we do differently, so that if we do get another surge, we're prepared for it, but also we're prepared to start putting services back in place.
Okay, and when the lockdown and social distancing came in Wales, did you have the experience that they had in other parts of the country where, in trying to prepare secure areas in hospitals that could be used for treating COVID, inevitably some of the maternity facilities were taken over because of the theatres, and that reduced the ability to do water births and in some cases home births? Did you have that kind of centralisation, which is then had to be unwound slowly as demand became clearer?
So we did notice that, especially with dedicated COVID areas, and unfortunately that happened mainly around our midwifery-led settings, the alongside units, which were probably the perfect place to have a distinct COVID area. That meant we had to rethink how we were going to provide midwifery-led care and provide that same experience for women. In relation to home births, we did look at staffing levels, especially initially when we had lockdown, and many staff were in self-isolation, but we didn't have the testing online. And so we had to think about whether we could provide those home birth services. There were some stories about free birthing as well. So we actually had a collective discussion about that. We never took home birth services away. And in fact, in some areas like Powys, we saw it very much as an opportunity to look after the woman safely in her own home. But it was all the time reflecting on the staffing levels and the safety for the women, but also the availability of ambulance services for transfer, which we knew when listening to places like London that the ambulance service had just been overwhelmed by the number of calls that suddenly happened. So we worked with the ambulance service to make sure that we were prepared for that should it happen.
And those are common factors that we've heard in other areas. Just on the numbers of home births, have you found that you mentioned free birthing, and that's been a concern in a number of areas and in a number of communities where anxiety, people just don't want to go near the hospital as opposed to being a choice that was much more limited previously. The home birth services and other things, have they managed to be restored? I'm referring to the fact that in areas in England where they have restored them, they've seen an increase in the numbers. Now that's an increase only from 1 or 2% up to 6%. And in one case in South Warwickshire, they had as many births in April as they had in the whole of last year. And the figures going forward into May were looking as though more women were exploring these options. Are you seeing that?
Yeah, in some areas we do have really high home birth rates, such as Powys, which is a very rural area and doesn't have a district general hospital. In areas such as Cardiff, they've seen a rise from 1 to 6%, which, yes, are small numbers, but I think some of that is around, concerns about coming into the hospital, but also the availability from the staff's perspective to actually provide online consultations like this and to look at any risk criteria and then make the decision with the woman about the best place for her to birth. I think the removal of some of the alongside units has maybe made women think more, especially around water birth, about birthing at home during this period, but it hasn't been an issue that worried midwives. They've worked with the women to ensure that they have the best possible experience that they can.
And those online consultations, that's one of the kind of things that's been accelerated. We did hear from some people in South Wales that, again, the phrase you used, what people have been working on for 2 years was suddenly completed in a few weeks.
Absolutely.
And has been acceptable. But that kind of consultation would have had to have been face-to-face in the past.
Yeah.
Do you think you'll be able to stick with that afterwards, or is that
Absolutely
under review?
Yeah, I think the pause and reflect bit that we're doing now is very much around how we're utilising some of the online communications that we've got to work in a more prudent way. And that was exactly what our vision for maternity care was around. I don't think we realised that we could turn it on quite as quickly as we have. And I think it's been brilliant. And in some ways, it's just fast forwarded our future vision by being able to put all these things in place so quickly.
Well, let's go to the other side of the world and hear from Amy Hargreaves, who's a professional officer for New South Wales Nurses and Midwives Association. Now, in Australia, they did close the borders earlier. You've had much of the lockdown experience that we've had. For people that don't know, Australia has got two huge urban conurbations in Melbourne and Sydney, and then significant rural challenges. But just describe the process that you've gone through. Has the anxiety levels been as high? Have the hospitals been stressed? And has any of that impacted on the maternity units in the way that Karen was describing? That they seemed to be the ideal facility to take over to make a secure COVID area. Or has that been a different experience in Australia?
So from my understanding, we have had separate COVID units that have been separate from the maternity units and away from the maternity units. Women are reporting feeling quite anxious about attending hospital services, but are attending. They aren't being well supported by the midwives in the maternity units. Our experience has been quite different, I guess, in that we haven't had the number of cases that the UK has had. I had a look this morning, and in New South Wales, where I live, we've had 3,035 people confirmed and 45 lives lost. But the hospitals have done a lot of preparation to prepare in case there was the surge that was expected at one point.
I mean, and I should say that is New South Wales still more than half the Australian population? So to only have just over 3,000 cases, that's quite a low level compared to the numbers proportionately we'd be having in the UK.
Yeah, so I think there's, again, I looked this morning and they said that the New South Wales website said that there was 250,960 people who've been tested, yeah. And with that 3,035 confirmed cases.
Yeah.
So,
I mean, Karen, how does that compare with South Wales, Karen?
Unfortunately, today we just got into 1,000 lives lost.
1,000 lives. And you've had what, 45 in New South Wales?
Yeah.
Yeah. And how are people in Australia looking at the future? I mean, we've all been watching New Zealand almost appearing to get away scot-free. We've been looking at the discussions about Australia and New Zealand forming a sort of common area where people would have to be tested to come in. But when you start to reduce the lockdown, you will still face a lot of the same risks if you don't have the tracing and testing. Is the tracing and testing strong in Australia?
Yes, I don't have any direct experience with it, but I believe it is. They've released a new app, a government app, asking people to download the app, and apparently it's sort of a Bluetooth handshake with other people with the app, so that tracing will be more effective once people come out of the lockdown. And they have reduced the restrictions somewhat over the weekend, but they still remain with social distancing.
Yeah. And have your schools gone back yet?
No, different states are doing different things. I have 3 children, 2 in high school and 1 in primary school. And my son in primary school is starting back 1 day a week from next week, which is the week 3 of term 2. So he's been off now. We had the Easter holidays, so 3, 5, about 6 or 7 weeks of school. And my daughters don't go back until week 5. So they've still got 3.5 more weeks before they go back. And it's a gradual return to school.
I mean, Australia's got quite a strong Chinese community and a very big Chinese student community. Is there any indicators in the way that they've been affected? I mean, I understand the students didn't come back, which is...
They didn't come. There was many, because when they closed the borders, people weren't allowed to return. And from what I understand, there's been significant impacts on the universities with those students, and they've moved very effectively and quickly to online learning.
And in the schools of maternity and midwifery, have you? I mean, in the UK, we've had 2nd and 3rd year student midwives on the short courses going back into service, especially some of the ones who had been nurses before, or student midwives in their 3rd year have been stepping up and their courses altered to 80% practical, 20% online education. Have those kind of measures been taken in Australia?
No, there was some discussion about the employment of nursing students and midwifery students. We have a couple of different models in Australia. So students are employed as an assistant in midwifery in some hospitals, and we do have nursing students employed as assistants in nursing as well. But that's in addition to their clinical placement positions. We have heard discussion about students not being able to attend clinical placements for a variety of reasons. Also, women are only generally allowed to have 1 support person during their time in the stay in the hospital and while they're in labour, and then that's affected the ability for midwifery students to attend with the women.
We've had the same kind of rules that have operated in the UK. I mean, a lot of women have had to attend consultations and scans and things where they had to be face-to-face. In Wales and in the rest of the United Kingdom, they've had to attend alone, and then they can have their partner at the birth, but quite often only for a short period of time afterwards.
Yeah.
Is that what's happening in Cardiff and in Wales?
Yeah. So our visiting policy is that partners can attend from the same household in active labour, but apart from that, the partners unfortunately aren't able to attend the unit. What we're trying to do is we're trying to make it as easy as possible for families. So we are saying that in some of the consultations, they can use things like FaceTime with their partner so that he feels part of it. So we're trying our best, but yeah, it's very difficult. But at this present time, we need to reduce visitors in the unit.
And just ask Amy, in Australia, have you, I mean, in the UK, a number of the units and things have been reporting that anything up to 20% of their midwives have either had to be practicing self-distancing because somebody in their circle has shown signs of the virus, or they've had to stay away because they're shielding an elderly or vulnerable relative and might risk bringing the virus back in to their home. Have you had that kind of impact? I mean, at the same time, people have reported that sickness has been lower, but nonetheless, there's been a big gap in the workforce because of shielding and self-distance. Have you had that kind of experience in Australia?
No, I really can't speak to that. I'm not aware of it. I know that there was some discussion about nurses and midwives and other essential workers having access to and wanting access to housing. So if they did had to self-isolate, or they had vulnerable family members at home, that they could stay away from their homes if needed.
Yeah. Well, So, I mean, Karen, have you been doing that certainly in London and across parts of England? We've had midwives and students staying in university accommodation, staying in hotels beside the hospital, isolating themselves from their own family, and basically for long periods of time staying inside a self-distancing bubble. Has that been?
I'm not aware of any individuals that are actually doing it in Wales. I had heard about it in other areas of the UK, but yeah, I hadn't heard of it.
But one of the people on our advisory board is traveling. She travels from the northwest to work in Essex, and she's been staying in student accommodation, which she says is very nice. And certainly there appears to have been quite a bit of that in London and other areas. But it's slowly beginning to unwind again. The pressures are coming off, the numbers are coming down. Now, Amy, what we've had in the United Kingdom is we've had what are called Nightingale hospitals set up in huge conference centres, a bit like the original hospital that was built in 9 days in Wuhan that looked like a series of building site boxes joined together. Well, all the major exhibition centres have been taken over, and they've been called Nightingale hospitals, waiting for the surge, which, although the surge has come, it hasn't spilled over in a big way from the main hospitals. And the big Nightingale in London, which I think had up to 2,000 beds, but has only had to use a small proportion of them, had its last patient yesterday, but it's being mothballed in case there's a second wave. Have you had anything like that in Australia, or have your hospital capacity has always been up to it?
Yeah, I think so. I think, and that's why the government, I guess, is, from what I understand, is very pleased, because that we were able to sort of, as they say, flatten the curve, so that we have had capacity. I understand that there were plans in place if that was needed, but no, we haven't, from my understanding.
And you've not had to go back into the register and call back retired midwives? I mean, we've been doing that as well.
They did. They've created a pandemic sub-register, where any nurses or midwives who had left the register in the last 3 years were placed back on the pandemic sub-register with the option to opt out if they needed to, so that there was the surge capacity of workforce if required.
And Karen, so you had, where was your Nightingale Hospital in South Wales? It's not at Celtic Manor or somewhere, is it?
No. So we've got a few. We've got one in the Principality Stadium, so the big rugby stadium.
I was going to say, just in case you want to have a rugby match. Yes.
Yeah, the Scarlet Stadium, and then they're using places like Bluestone, which is a sort of holiday park, as rehab areas. So there are calling them field hospitals. The Principality is called Dragon's Heart Hospital. So
and we've just had the first Mary Seacole Hospital named. But I think policymakers here in the UK are still being very cautious about a second wave, and at the same time, they want to keep these facilities so that the next time the mainstream hospitals can keep on doing the heart and stroke and cancer operations, because that's become quite a big issue, the postponement. And people are beginning to look at what the impact of the postponement of elective surgery and other treatments might be. Amy, have you had that in Australia? Have you had the postponement of other elective surgeries and treatments to create capacity?
Yes, they did. And I'm not completely across what's happened, but I believe that's been loosened in the last few days. Yeah.
Okay. Well, I think
no, they did do that.
I think we now know why Australia is called the lucky country by comparison with what we've been going through. Hopefully, you'll stay that way, but you can rely on advice from people like Karen and others in the other bits of South Wales at the other side of the world. Can I?
We'll look for the rest of the world to see how they've managed the women with COVID during pregnancy and birth.
Yeah. Would be very good. Okay. So thank you both very much for what has been actually quite a fascinating comparison. And we're now going to move on to some more of the videos that we've been showing through the course of the day. These are some of the top videos from Maternity and Midwifery Forum. This program is supported by Matflix, which is video streaming from maternity experts, designed for students and for people doing their revalidation, and particularly just recently launched and particularly useful for these times. My name is Neil Stewart. I'm the editorial director of the Maternity and Midwifery Forum, and we will be back with some more guests at 6 o'clock. But to take you there, we've got a couple more presentations, and I recommend to you Abigail Holmes and a rather interesting presentation. If anybody has been watching the Tenor Pants adverts row, I recommend that you follow this. And we shall see you again at 6 o'clock.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.